Dr. Chesney Thompson is here with me now talking about cutting-edge topics in OB-GYN. I am sure you are going to cover a wide range here. What are some of the key topics that you're expecting?
This is a session that is really, it's about anything and everything, and it applies to anybody and everybody. So it really covers a wide range of possible topics. It could include anything from legal to legislative issues coming down through state or federal levels that might impact on clinical health care. It could regard education and teaching for residents and trainees. It could include quality improvement and new metrics for practitioners to consider. I think probably the low-hanging fruit, or what a lot of the audience will want, is clinically relevant information. And that is wide open as well. It could be new clinical guidelines. There are several new screening guidelines that have been brought up over the last couple of years. Some of these are poorly understood, or at least not well employed. Breast cancer screening is certainly one, cervical cancer screening, the new sexually transmitted infections treatment and screening guidelines came out in 2015. That might be something that we'd see. The other thing is clinical algorithms or clinical management, new devices, new technology, new procedures, anything along those lines are, I think, something that someone's going to show up and would expect to learn.
Wow, a lot of critical information.
There's no shortage of information, yeah.
One of those topics I'm sure that will be touched on is the Zika virus, because it certainly impacts OB-GYNs, but it really crosses many disciplines in medicine.
Absolutely, and we're going to hear from representatives of different societies, maternal fetal medicine and GYN oncology and reproductive endocrinology. And so a topic like Zika might come up in several of the presenters because it's relevant for the MFMs, it's relevant for the reproductive endocrinologists, it's relevant for the academic specialists. So absolutely, we might see that. Another topical item, the uterine transplants, which have been done the last couple of years, including this country. And I don't think the audience is going to walk out ready to do a uterine transplant, but why is that relevant, or what does that mean, and what are some of the ramifications from the learning curve from that? And
how close it might be to being more routine.
Sure, absolutely.
And there are also going to be some potentially controversial topics, the mid-urethral sling.
Correct. Yeah, there are, particularly in the media. I think a lot of this is really largely due to misunderstanding, but the mid-urethral sling issue, I'm sure we'll hear from the AUGS upon that topic. A couple other, I think, controversial subjects we could hear about. There is a lot of press about the adverse effects from HPV vaccine, for instance, and there's also a new HPV vaccine that was approved, well, over a year ago now.
And the more information that physicians have about these, they can answer the questions and the concerns of patients as they come in.
Sure, without a doubt. And I think, again, that's why people are going to come to this session. They're going to learn some of these. They'll walk away with kind of talking points and understanding. I think, again, if there are little clinical pearls that they walk away with and say, well, this is kind of how I'm going to do this now in my office, that's great. And some of it won't really answer complete questions, but they'll walk away having a better understanding and how it relates to their particular patients, for instance.
And what would then be the goal for people as they come back year to year to these discussions?
Well, I think just that. I think it puts things on their radar screen. To some degree, some of these things might be a bit more futuristic and something that's really not going to go, they're not going to go home and apply, for instance, now. But again, knowing that it's coming down, whether it's maybe something through, like I said, like through their state legislature, or maybe clinical guidelines are being firmed up and they're not ready for prime time yet, but down the road, that'll be something. So kind of more of an awareness.
And knowing what they need to keep their eyes on as they look into the future.
Without a doubt, absolutely.
Dr. Thompson, thank you so much.
Thank you.